Hi, everybody. We're going to get started here shortly. I'm going to let everybody have a moment to jump in and get online with us. So give us just a couple minutes. Okay, it kind of looks like the jumping in has slowed down. So everybody that's going to be on time, I think, is pretty much on the call. It'll be interesting to see how many we have by the end of the call. We'll see. So Charity, you want to take it for us?
I sure will. Thanks, everyone. My name is Charity Farnsworth. I'm the Senior Vice President with Healthcare Consult Link, and we do appreciate you joining us today. I'm going to do a brief introduction before Amy gets started with her presentation. So Amy, will you go on to the disclaimer and then we can hit the next slides after that? So we have a disclaimer here. You can read through that, but basically we just want to let everyone know that the information that we're giving today is for a general audience and that it's not intended to provide any specific agency information. If you do have questions, we can answer as many of those as possible at the end. And of course, we're always available for you to reach out about things that are more specific to your agency, but we just wanted to make sure that we included that in our presentation. Now, the next couple of slides will go over our pandemic recovery series. We do have a website for the series where you can go to get recordings of each of the sessions in case you either missed one or maybe you're unable to attend in the future on a particular day, but you're interested in the topic. We also are posting the slide decks from the presentations. Unfortunately, today we did have a last-minute travel change that affected our presenter, and so Amy jumped in to fill in today, so we did not have an opportunity to get those slides posted before the call. They will be posted afterwards, and so if you want to follow along during the call, those will be posted this afternoon after the call. But as you can see from the sessions that we've listed up there, we've done 4 sessions already where we talked about everything from economic incentives, emergency preparedness plans, infection control, QAPI, operational efficiencies, and some other financial considerations. In today's session, Amy is going to talk more specifically about the emergency paid sick leave and expanded FMLA programs. And then Richard, who was going to present today, is going to present next week now on some legal aspects of pandemic recovery. We've gotten quite a few questions about the employment aspects in particular, so he will be addressing those. And then we're going to wrap up our series in sessions 7 and 8 with the psychosocial impacts of the pandemic, rebuilding agency operations, and then looking for ways to grow your agency and potentially expand it. We know that census has been hit in many agencies because of COVID, so it's not just a matter of growing overall. It may be even getting your agencies back to where you started. And so we will have the 8 sessions still scheduled, and so we do hope that you will come back and join us after today for additional ones, and that you will go back and check out our website to look at what we've already covered, where we have the recordings and the presentations available. Now, for today, we do have, like I said, myself on the call. Amy Knight will introduce herself when she gets ready to present, but I also want to make sure that I introduce Heidi Wall. Heidi is our hospice director at Healthcare Consult Link. She is on with us as well to answer questions, and so we wanted to make sure you knew who the presenters were today. And then Amy, I will let you take it from there with the agenda since these are going to be your topics, and we will be available for questions at the end. And I do want to add really quickly on the questions. We do have the chat function available in Zoom, but if you have any questions, if you wouldn't mind using the Q&A, that allows us to track those questions, mark them as answered, and also do any follow-up related to them. It's easier for us to do that and maintain the information through the Q&A versus the chat. You're welcome to use the chat, but if you do have questions that we need to circle back to, it would be great if we had them in the Q&A. So, okay, well, I'm going to turn it over to Amy now.
All right. Thank you, Charity. My name is Amy Knight. excuse me, I have some allergies working with me today. And so, and I'm also just always real scratchy, but it's especially scratchy today. So anyways, I'm Amy Knight with Knight CPA Group. We are a CPA firm here in Austin, Texas, serving clients across the country. And we only work with home health, hospice, nursing homes, assisted living. So we kind of stay, breathe, live in the post-acute and long-term care arena. And we're a full service accounting firm. So this was a quick adjust. I will say there might be some typos. We got this put together this morning. Luckily, I've already gone over, I've presented much of this material already. And so it's not new to me. It's just got thrown together really quick. So thus I didn't have time to blow dry my hair today. I had to come up here and get the presentation ready. So let's jump in. I'm sorry, let me back up. So one thing that did not get added to the agenda, I'm going to start with a very quick update to the HHS Provider Relief Fund reporting requirement that came out after last week's webinar, in which I discussed what was going on there, and there were some drastic changes. So I'm going to update everybody on that. I did send a follow-up video, but I just want to make sure everybody got that information. But then we're going to go into this the whole rest of the time. So we do have an hour and a half scheduled. I plan to speak for about an hour on the material, or maybe an hour and 15 minutes, and leave ample time for questions at the end. And we will stay on and answer questions as long as you keep asking them. And it's all going to be spent on it. This is not part of the CARES Act, although everything is being called part of the CARES Act. This is actually part of the very first act, which is the FFCRA, Family First Coronavirus Response Act. And so it's the emergency paid sick leave and extended family paid leave. That's what we want to cover because we're getting a lot of questions about that. We had a request to really do a deep dive in this. So I'm going to cover it, and I'm going to give you what I know, but I am not an attorney. So when any questions arise that are very specific or might get into legality nature, I'm going to defer those to Richard, who will be on next week, and he'll have a section of his presentation devoted to this topic as well. And so we may not be able to answer all those questions, but I still encourage you to post them, because then we can pass them to Richard so he can be anticipating them next week. So we'll go over that, and we'll dig into the details like the covered employers, eligible employees, qualified reasons, and then the duration of leave, how you calculate the pay, and what tends to be skimmed over a lot is the actual tax credit that you get for it, and then how it works with other legislation that's out there. So let's just jump in. So real quick on this HHS Provider Relief Fund update. In the beginning, the actual CARES Act called for any provider that received over $150,000 in HHS provider relief distributions, whether it was one distribution or an aggregate of those same distributions, 150,000 or more, you had to do quarterly reporting. Well, it therefore excluded quite a few providers. However, HHS came back out this last week and said, no, anybody with over $10,000 is going to be required to report how they spent that money. Drastic change. So you're going to want to really pay attention to that. I'll tell you my 2 cents on what I think happened when I get through this. What they're going to do is there's going to be a reporting portal. It is going to open on October 10th. And kind of what they're saying is they want you to do 1 or 2 reports, but that's all. So it's not going to be a quarterly reporting. So come October 1st, if you've spent all of your HHS money, you can go report it. If you spend it by October 27th, then after you've spent it, you can go into that portal at any time and report it. But anything spent in 2020 is required to be reported, even if you don't spend it all. So if you haven't spent it all by December 31st this year, you're required to report what you did spend no later than February 15th of next year. And let's say you just don't want to be overly aggressive and you don't want to go do any reporting until you just have to, and maybe you've spent it all. Even if you've spent it all now, you're required to report by February 15th, 2021, but it will be open and you can do your reporting early, get it done and over with, right? Now, if you have not spent all of your money by December 31st this year, again, you're going to have to report by 2/15 what you did spend, but then anything spent in 2021 has to be reported by July 31st of 2021. So there already I got a question, well, what if we're not done by December 31st, but we're done by February 15th? I don't know yet. I don't know what the portal looks like. My guess, educated guess only, is I bet they want to report it in two separate buckets. Here's what we spent in 2020. Here's what we spent in 2021. And I think you can do that at any point along the way, but the requirement is that 2020 spending must be reported by February 15th. So, okay, I think I've got that pretty clear. Now, with this reporting due by July 31st of next year, the way I interpret that is they're assuming everybody will have spent all of their money. And you know, earlier in the beginning, we were saying, you know, because we had this PPP stuff that had a very small window of time to spend it, we said, well, HHS is a much bigger window. It looks like you can take all the time you need to spend it, et cetera, et cetera. I think that's probably not going to be the case. I think they're going to want it spent by July 31st. Now, I don't know that. These are educated guesses. Just want to get you kind of thinking about it. I kind of want to reverse some of the other opinions we put out earlier saying it looks like they want you to take your time spending it. Now I'm thinking that maybe you need to spend it by about this time next year, right? Although I know here in Texas, we're really starting to see a lot of the impacts now, and my providers, my clients are really spending through it much quicker now. I don't think it'll last until July of next year anyways. One of the questions, if they want it all spent by July 31st and you haven't done so, are you going to be asked to repay it? I don't know. These are things we're going to be watching for. They also did say, so the only update that came out was the when are we going to report, the who and when, like who has to report and when, but we don't know the how yet or what. Like we don't know what forms, what documentation, we don't know how to actually submit it. We were promised that by August 17th, they would have more information on how and what to file. So stay tuned for that. We'll get you an update as soon as we find out. All right, so moving on. Also, just real quick note, if you need more of that, I do have like a 3.5-minute video on my YouTube channel strictly about that message right there. I did it after last week's webinar when I found that news. You know what, let me back up one more slide again. I did not get it put in here because again, it came out in a blast after I'd already sent Charity my slides to do a review for me. They are saying any provider that received more than $750,000 in aggregate from HHS provider relief funds will be required to have an audit. And I read it as not Medicare is not going to come audit you or Medicaid, but you're going to have an audit of your financial statements. So if you don't already get audited financial statements, which most people do not, but you receive that much money, which means you're a very large provider, well, depending on the 2%, whatever, you're going to either have audited financials or a single audit, which is something very specific. So you might, if you're in that range, none of my providers receive that much money or even close to it. So I don't have all those details, but I did see that blast come out. So just so you know. So jumping on, emergency family medical leave, that's backwards. I like saying emergency paid sick leave, and it's actually expanded medical and family leave. These two pieces of legislation were done in the very beginning, and they both fall under this Family First Coronavirus Response Act, the FFCRA. And it is only applicable to employers that have less than 500 employees. Now, just because you have over 500 employees does not in my mind mean that you're exempt. It means this does not apply to you. I believe there might be some other requirements that do apply to you. It's just not in this. I think you would want to contact your HR team, HR professionals, your payroll company to kind of find out what might apply to you. I know there are probably lots of you out there. If you have more than 500 employees, none of this applies to you. Um, so there are some exemptions as well. And it so happens that healthcare providers, such as yourself, emergency responders, and then very small businesses with 50 or fewer employees, you are exempt. However, you're exempt meaning you do not have to provide these benefits. However, you can provide these benefits. So my 2 cents is, as a healthcare provider, if this benefit is available for you to provide, and you're going to hear later that the government's going to pay those wages dollar for dollar, then for me, it behooves you to utilize it if it makes sense for your agency. Okay, so just because healthcare providers are exempt, you can still offer it to your staff. So who is covered? So it does cover publicly traded companies and private employers, but again, fewer than 500 employees. And it also, they kind of excluded employers that were less than 50 employees. I'll be very honest, I've not yet run across anybody that is not offering this to their employees. And then again, healthcare providers and emergency responders may also exempt themselves if they don't want to. Now, I'm not trying to peer pressure anybody. If you're a healthcare provider and I am seeing this, if you feel like your employees may take advantage of you by saying, hey, I need to go quarantine, we'll get to the reasons in a minute, and you don't want to offer it because you think that's going to create a can of worms, that makes sense, especially maybe with some PAS providers. That's kind of where we're seeing that. So just know, as a healthcare provider, you can decline to offer this to your staff. So who are the eligible employees? So for the sick pay, the paid sick leave, every employee is covered, even if they've only been with you for 1 day. If they've been, to qualify for the paid family leave, then they have to have been with you for 30 days and they can get an extra 10 weeks. And we'll get into we're going to cover the qualifying reasons and how long and how much pay they get and how to calculate the pay. We're going to get to that, so don't worry about these notes just yet. And federal government employees, you guys are covered under Title II, and you're not covered by the Emergency Family Medical Leave Act because you have your own coverage, but you are covered by the Emergency Paid Sick Leave portion of the Act. So this is how confusing they make everything that they put out, basically. So again, qualifying reasons. I wanted to have less words on this slide, but I also want them all in one place. So let's go over them. The employee will qualify for paid sick time if they are unable to work or telework, so work from home, due to one of the reasons below. I'd say below. So federal, state, or local quarantine or isolation order. They've been advised by a healthcare provider to self-quarantine, and I like to issue a little qualification here. Yes, you are a healthcare provider. However, you are not your employee's healthcare provider. So it needs to be their doctor or their clinic, or they've gotten out to seek guidance and diagnosis, and so they were told to quarantine, but not by you. If you are experiencing COVID symptoms and then your employee is experiencing COVID symptoms and going to seek a medical diagnosis, that's a qualifying reason. If they are caring for an individual subject to number 1 or 2 above, so they're being quarantined for one reason or another, and they're caring for one of those, they qualify. Number 5 is if they are caring for a child whose school or place of care is closed. So no COVID symptoms, no isolation or quarantine order. However, daycare is closed, kindergarten's closed, there's no child care available, and I can't work from home, so I have to stay home and take care of my child. That's a qualifying reason. And then lastly, of course, they always got to put in a little extra, is experiencing any other substantially similar condition as per HHS. So I don't know anybody that falls in number 6 yet. So if an employee qualifies, any employee that number 5 is where you qualify for the expanded family leave. Everything else you qualify for sick leave, okay? So let's jump into that. And I might flip back and forth, but for reasons 1 through 4 and number 6, so all the reasons other than caring for a child, a full-time employee is eligible for 80 hours of leave, 40 hours a week. They get 2 weeks of leave at 40 hours per week. If they are part-time, you have a lot of this. If they are part-time, PRN, they are eligible for the number of hours that they normally would work in an average 2-week period. So what you want to do is you want to take probably a quarter of data, maybe first quarter before all this broke out. Take first quarter total hours worked divided by however many weeks. There's either 12 or 13 weeks in that first quarter. That's their average weekly hours. They get 2 weeks at that for that number of hours. So let's say they average 15 hours a week because they're PRN, then they qualify for 30 hours of emergency paid sick leave. Then for reason number 5, the full-time employee is actually eligible for 12 weeks of leave. They get 2 weeks under the paid sick leave, then they get an additional 10 weeks under the expanded family leave. Okay, so that's how these two work in conjunction with each other. If it's a part-time employee, it's kind of what we just discussed. Again, they get 12 weeks, but it's at their average number of hours worked on an average week. Okay, so again, if they got 15 hours a week, oh dear, don't make me do that math. 15 hours a week times 12 weeks, that's 180 hours, right? So it depends on how many hours they work on average. So anybody out and not being able to work from home due to caring for a child gets this expanded family and medical leave. Now, how much do they get? How much pay do they get? For reasons number 1, 2, and 3, which is a federal, state, local quarantine order or isolation order, they are, this is why sometimes I go back. Number 2, they've been advised by a healthcare provider to quarantine. Or number 3, they're experiencing symptoms and they're seeking medical diagnosis. So for one of those 3 reasons, they get 100% of their regular pay rate up to $510 per day up for 2 weeks. And that's going to be a total of $51.10. If you've got somebody at that, that's about $12.78 an hour is what their pay rate would be. So, you know, if you've got some nurses at $22 an hour, you're going to get hit by this cap. So be sure you're aware of that. Now, this is going to be paid sick leave. If it's for reasons number 4 or 6, again, let me flip back. Number 4, caring for an individual that's under quarantine or isolation order, or number 6 is anything else substantially the same, they're going to get 2/3 their pay rate, up to $200 per day. So again, another cap you really need to be aware of for a 2-week period. And again, it's going to be paid sick leave. You need to know and you need to understand which pay item, which of these benefits are you paying people under? This is your responsibility as the employer. It's not your payroll company's responsibility. It's not your accountant's responsibility. Like, you're the one on the front lines with the employee. You need to know who is getting paid under what. It would be the same as if you're paying them vacation hours or sick hours, or maybe you just have a PTO bucket and you're paying them PTO hours. You need to know, are you paying people sick hours, paid sick leave, emergency paid sick leave? Are you paying them, regular sick leave, which we're going to get to that in a minute? Or are you paying them PTO? Like, you need to know what hours it is that people are getting paid. Okay. And then reason number 5, caring for a child, it is also 2/3 of their regular pay rate, up to $200 a day, but it's a max of $12,000 over a 12-week period because they get the full 12-week period. Now, one thing I did not put in here is, remember, the part-time also falls into this. 2/3 their rate for the number of hours that you're paying them for. So like in the last slide, we talked about let's say it's a part-timer under number 4. So part-time employee is eligible for that. They work 15 hours a week. So they're going to get paid 30 hours under emergency paid sick leave because they got reason number 4. They're going to get 2/3 of their pay rate for that 30 hours. And it's going to be max. The max of 200 per day, that still stays the same. So there's no change because they're getting paid less hours. It's still a max of 200 a day. You might intuitively think it should be decreased, but they didn't do that. They didn't go into that much detail. Okay. So a couple things here. You need to know how many hours you're allowed to pay them, and you've got to track that. If it's 8 hours in this pay period, okay, well, they're eligible for another 32 hours in the next pay period. You've got to track all that. You're responsible for making sure all of that is right, not the payroll company. I don't know. The payroll companies may have set up their pay items for those specific categories, and it may limit somebody at 8 hours a week, but I kind of doubt it. So you just really want to watch these and make sure they're accurate. So some special considerations, and we're going to probably have lots of time for questions. Special considerations. Paid sick time under this act does not carry over from year to year. They don't get to use it from year to year to year and say, hey, I didn't use it last year, but I want to use it in January. It doesn't work like that. This is not regular company sick leave that they might qualify for. They are not entitled to reimbursement for any unused portion. So if you've got somebody that never had to claim this, that's great, but they don't get paid any extra because of that. And it's not due upon leave of termination, resignation, retirement, or anything like that. They can elect to use, I don't know why they would, but they can elect to use their accrued vacation or personal leave before using this benefit. You can require that they use their own personal sick leave, vacation, or PTO bucket before paying them this, although I don't advise that, because again, we're going to get to this tax credit in a moment. The government's going to reimburse you for those wages instantly, right there out of your taxes that you would have paid on that tax deposit. So why make them use their hours when they can use the government's hours, essentially? And then this provision is effective from 4/1 through 12/31. If you had employees back in April that had to take off because of this and you want to go back, your 941 for that quarter is due tomorrow. You may have already filed it. If you wanted to go back, you could, but you'd probably either have to fix your 941 before you file it or amend it, because all of that needs to be filed appropriately. They did put out a new 941 schedule for the second quarter. It's got a whole lot of extra lines on it, and it talks about the payroll tax deferral, which I did put a couple slides, probably just one, but we'll spend some time talking about that. And these tax credits, it's all in there. So you do have to report it correctly on the 941. But even if you did not get reimbursed from the government back in April, you can still go back and claim it. Now, this starts kind of treading on legalities a little bit. So I'm going to just say what I know and then put it out to Richard to let him really solidify this. Because I've seen conflicting. It depends on if you're coming from the employee's perspective or the employer. As the employer perspective, I'm being told by the IRS, I need documentation as the employer to claim the credit, which means for me to pay you that sick time under this act, you have to prove to me that you qualify under those reasons, one of those reasons. So if you're seeking medical diagnosis, I need a doctor's note. If a doctor told you to quarantine, I need a doctor's note. Some sort of evidence that shows me that this in fact did take place is required for me to claim the credit or for the employer to claim the credit. So what I found is, but I've seen a lot of places that, a lot of sites, websites, and informational places that I found information on this. Department of Labor is great, IRS is okay. They don't talk about it at all, but I dug deep enough to find a couple of places that did say you need some kind of documentation of what government entity issued the quarantine, if it's that number one is their qualifying reason, or the name of the healthcare provider who advised it. I mean, I kind of went a step further because it did happen with me. Again, I did not check with HR. And I said, I need to see testing results, right? But that kind of starts getting into Privacy Act and things like that, that I am not versed on. And so I'm not going to go there. Heidi might be able to help us some. I'm not sure how well versed they are on that. I really think that's kind of a Richard question, which is going to come up next week. Healthcare coverage must be continued by both the employer and the employee contributions. Again, there's a credit for this at the back side of it. So, and you cannot go back prior to April 1st, right? All of this starts on April 1st, nothing prior. Forgive me for a minute. So this does not have the greatest resolution, and I apologize, but in the slides, you can read it pretty well. It's just a nice little flow chart. You might just print it to a separate PDF file by itself or something that really just kind of walks you through what they might qualify for and how to figure out, because it gets a little confusing. But once you really digest it, it's not that. Here's the deal. Once you have an individual that you feel like fits somewhere in here, you've got a definition, and then you go figure out, okay, which qualifying reason do they qualify under? Number two, okay, cool. Then number two, how many hours? It's very well defined. Okay, I got my hours. And number two, what rate do I pay them at? Okay, that's all defined. So once you actually have an example and actual, it happens to you, you'll be able to walk through this flow chart, the information in the slides, the information you can find online, and decipher it. And it's not as fuzzy as it all kind of looks coming off. So I keep mentioning tax credits, free money. So that's the deal. The government is covering these wages for you. That's why it's a big deal. It's also becoming a bigger deal here in Texas because we're starting to feel the impact a little bit later than some of the other states. Some areas are really being hit real heavy right now. And so it seems like there's a lot that are out because of COVID for one reason or another. And so people are really asking a lot of these questions. So I think this timing is pretty relevant for this information. So the FFCRA provides relief for both the sick pay and the family leave, the sick leave and the family leave. It is a dollar for dollar credit reduction on your next payroll tax deposit. You get to claim the amount of wages paid under those exact benefits, the cost to continue the healthcare coverage for that employee. Now, I don't know how you add that in. I think that's going to have to be kind of a manual thing, and it might have to go on the 941. I don't run payrolls anymore, so I don't know exactly what that all looks like. And then also the employer's share of the Medicare tax on the leave. So you are still going to be required on those wages. Let's say you pay $2,000 in those wages. You're going to get reimbursed the $2,000. You're still going to have to pay FUTA unless they're maxed out. You're still going to have to pay SUTA unless they're maxed out. You're still going to have to pay your 6.2% Social Security tax, but you're not going to have to pay the Medicare tax. I don't know why they defined it that way. Don't ask me that question because I don't know. But the Medicare tax is 1.45%. So the good thing, so you get that is also part of the credit. I'm sure the payroll companies have that built into the calculation of the credit, so they know to reduce your tax deposit by that amount. That's what's critical here. There is no time like the present to outsource your payroll if you're not already doing it that way. Your payroll provider needs to know how to do this for you. If you are a small company and you're using a very small, single office payroll provider and they say they don't know how to work with this, I beg you to change payroll providers. They need to, if they're going to call themselves a payroll company, they have to know how to do this. If you're working with a CPA office or an accounting office and they do your payroll, they must know how to do this. The information is out there. It is not your job to know how to make the payroll system do it. It's your job to say these employees are being paid under these items and I need you to calculate the taxes at the tax credit properly. That's my opinion. Yeah, maybe some payroll companies disagree with me, but that's where we're pushing the work to the payroll companies. Now with that, you want to make sure, I don't know if I have a slide on it, so let me just back up, that you have like very specific pay items set up, right? You don't just call it regular wages and say, oh, well, 20 hours of those wages was sick pay. No, it's got to be a very specific item. And your payroll company is going to know that. They're going to make you set up a specific pay item. So what about all of this all together, which, and you know what, not listed here is the HHS stimulus, but you got PPP funds, HHS stimulus, and now you got this emergency paid sick leave, emergency family medical leave. How does all this work together? The good thing is HHS, take it out of the equation. Doesn't matter whatsoever. If you do or do not have an HHS distribution, no impact on this. Well, actually, that's not entirely fair. Let me get to that. Again, this is what happens when this presentation gets put together the day of the night before. I'll circle back. PPP funds. If you have a PPP loan, you need to be very, very careful. Along the way, we were saying, hey, PPP loan, pay COVID wages, pay hazard pay, pay hazard bonuses. It's all good under PPP. That's true, but you need to make sure that these sick paid, anything that's getting a tax credit does have to be excluded from your PPP loan forgiveness calculation. And I've got an example to show you how we're doing that. So you can still participate in PPP and claim these credits, but you can't double dip. So get the credit, but just exclude it on your PPP forgiveness calculation. Here's what that would look like. And this is where I'll talk about, because we do have plenty of time, a little strategy for you, for those of you that have PPP and HHS funds, which is a lot of you out there. This is only a summary of what, I've got like 4 or 5 tabs behind this, and we were doing this week by week with all the expenses, but this would be an example of somebody that we were tracking their PPP spending for, so that we could make sure they were on track. And so that's kind of funny that my mouse cursor is right there because I'm trying to move it, but it's a screenshot. So what you want to do is, I think for your calculation and for your forgiveness application, To me, you want to be as clear as you can because you're giving this to a banker that's going to be swamped, inundated, and have more work than they can handle. So the easier it is to follow your work, the quicker they're going to be to respond to your forgiveness application. That's my approach. So what is ideal is you run a payroll report for this entire period. So let's say this loan was funded on 5/10, they got $800,000, and they finished spending it on the 7/22 payroll. Okay, well, their total gross wages for that whole entire period, we ran one final payroll journal entry, is because that's how we're going to do the forgiveness application, was $775,000. Well, then we have to reduce those wages by anybody that was over the $100,000 annualized mark, and anybody that that's a non-resident employee. We haven't had any of those yet, but I left it there. So we reduced it by 25,600. These are all fictitious numbers. We have also been advising clients to pay things such as COVID missed visits. Like if you're a PAS, and you really want to pay your attendance even though the client is refusing services. And you say, you know what, I want to use either my PPP funds or my HHS funds to help pay those wages and keep my employee because she's a good employee and I don't want her to go to unemployment and then not come back. So I'm going to pay her under some of this money that I've got. Originally, we were saying pay it under PPP. We've actually kind of pivoted in our advice on that, and our advice has shifted. If you received, it's still fine to do it under PPP. It's allowed. However, if you've got PPP and HHS funds, it's also allowed under your HHS funds, and you have fewer expenses for a longer period of time to justify the HHS funds than you do on the PPP side. Like now that the time frame has been extended on PPP to 24 weeks, you can exclude your COVID special pay, pay it under the HHS, exclude it from PPP. It makes your PPP cover your regular wages longer, and now HHS is picking up your COVID pay. This is only relevant to you if you if you have not been hit hard with a decrease in revenue, and you're having a hard time justifying spending the full HHS fund. Depends on your size, depends on where you are, how you got hit, whether you think you might get hit later, those kind of things, right? So this is just a little strategy. One formula doesn't have to fit everybody. But what I want to get to is down here, again, I can't really point to it. I think it has a pointer, but this COVID-19 quarantine, you know, I have a client that's what they called their emergency paid sick leave pay item. There's a credit available for that. That's just my little note in there. This is the pay item they are using for the FFCRA benefits, the extended paid, the EPSLA and the EFMLA. I can't even say all those acronyms. Now, some people are just calling it COVID-19 or even just emergency paid sick leave. Whatever you do, you just need to denote it so that you know what it is. If you're setting up your own pay items, you need to make sure every payroll system out there has adapted so that when you set up that pay item, you can name it whatever you want, but there's going to be like a type or some kind of setting for you to set it to say this is emergency paid sick leave. And then you do another one. So you would not have one for both items, by the way. You would do a separate one that's Expanded Family Medical Leave Act. So you want to set those up properly, and you need to make sure you get help doing that. It's a lot harder to clean it up after the fact. And then we added back, again, this form is for a PPP loan forgiveness. We added back insurance, we added retirement benefits, we added back SUTA. We come down to here's our payroll costs that are eligible for forgiveness. I'm calculating the percent to total over here in the right-hand column. I've got the rent lease. Again, I was rushing. That should have been down under with the non-payroll expenses. And anyways, you can see on this one, they did that last payroll and they were $7,300 overspent on their PPP. And that's fine, right? Your payroll's not going to end perfectly and be the exact dollar amount. So again, that pay item is then refunded in your next tax deposit. So let's talk about the functionality of that. What happens is different, right? So you either are doing your own payroll where you pay payroll this week and you most likely pay payroll taxes next week. If that's the case, then if you've got everything set up right, let's just use QuickBooks, for example. A lot of people use QuickBooks payroll. You know, you run your payroll, you've got your pay items set up right. You paid $5,000 worth of sick leave, emergency sick leave. So you're like, okay, I've got a $5,000 credit plus the taxes that went with it, the Medicare tax. So then next week you go to do your tax deposit, and it should be calculated in there. It should, I don't know what it looks like on QuickBooks yet. I just simply have not had time to dig into it. Look, you know, I know in QuickBooks Desktop, you go to the screen, pay payroll liabilities, and you say, yeah, I want FIT, employee Social Security, employer Social Security, employee Medicare, employer Medicare, extra Medicare, because thank you, Obama. And then I don't know if there's going to be a credit, like in parentheses line for you to check to offset those numbers. I don't know if you just don't check the employer, that's something different. I'm not sure how that shows up in there, but that's what you need to be looking for. And, you know, I'm not going to apologize for not having all the answers. I wasn't even intending on, so my presentation next week was not even going to be about this, but I want to tell you to look for that, right? I don't have the answers right now, but so you can find them. They're out there. Look for it, research it. Your bookkeeper can help you, whatever. Now, if you are with a payroll service provider where ADP, any of the big ones, and even some small ones where they impound your account. So you run payroll, let's say check date is Friday, you run payroll on Tuesday or Wednesday, and they draft your account, and you usually see like 3 to 4 drafts. You got your net payroll, you got your payroll taxes, you got your garnishments, and then your billing, right? The payroll processing fee is typically how it goes. Then you're going to feel that impact instantly. Like you're paying $5,000 more in wages, but your tax deposit's $5,000 less. So your total payroll expense out of that draft, is the same. Okay, so well, it's not exactly the same because you do still have to pay the Social Security employer Social Security piece of that tax and the FUTA SUTA, but that's excuse me, it's still going to be minimal. So for the most part, you're reimbursed for the wages. So it's not exactly free, but it's very, very close. I'm going to move on to the payroll tax deferral. And I'm just trying to think if I'm missing anything else with regards to this. We got quite a few questions. This only takes me a minute or two to get through. So let me have a sip of water. Okay. So there is another benefit out there that you can take advantage of, and I'll be very honest. When it first came out, I was very not leery, but I was not very excited about it, and I thought this could be a disaster. And it could be, but it could also be done right, and it could provide some very needed working capital. And so I want to make sure everybody's aware of it. There is this payroll tax deferral. It is a deferral of your employer portion of Social Security tax. That is that 6.2 piece of the FICA match that you pay on all the wages. And in the beginning, if you had a PPP loan, you could not defer your taxes. When they did that flexibility act, payroll, whatever, when they fixed the PPP loan back in early June, they fixed that and they said, okay, even if you had PPP loan, you can go ahead and defer your taxes. And what this does is you can go back. I don't recommend going all the way back to March 27th. I would be okay going back to April 1st. And the reason why, March 22nd puts you all the way back to first quarter. First quarter's come, gone, filed. And so for you to defer, you know, if you had one payroll in that from the 27th to the 31st and you defer those taxes, I mean, unless you have huge payrolls, I just don't think it's going to be enough to justify amending a first quarter payroll tax return. That's my opinion. Now, second quarter, so April 1st to 6/30, you know, maybe you're just now learning of this and you're like, okay, I didn't know that existed. You probably have already filed your second quarter return, but it's due tomorrow. So you probably already filed it. But if you haven't, and even if you have, you can amend it. I just had one of my team research for me how this looks. And so again, remember I said they not amended, excuse me, they revised the 941 form effective second quarter. And so you can go in there and now there's all these line items. And so you show all your wages and all your taxes, and then there is a line for how much of your payroll, of your Social Security, employer Social Security tax are you deferring? And it calculates a number. And then it's going to reduce how much you need to have paid in. So what they're saying is this is a deferral. It doesn't go away. You've got to pay it back, but it's basically an interest-free loan. So here's how it works. You can defer from now, you know, from April 1 all the way through the end of the year, meaning you just don't pay it in. You keep that money yourself. You've got to account for it. This is where I thought it could get very ugly, very messy, very fast. But as long as your payroll system is accounting for it, you then have until December 31st, 2021 to pay the first half of it. So the first half is due next December. Second half is due December following. So you've got 50% of that amount as a 1-year interest-free loan and 50% as a 2-year interest-free loan, and really more than that if you count how long this year you have it. This could be a good use of cash. You just really, really have to plan that you're going to have a payroll tax liability, which nobody likes to have, because, you know, it's not dischargeable in bankruptcy. If your company fails and you never pay this in, it is the employer's portion, so maybe you could get out of it, but you know, these are the tax people that go to your grave with you pretty much. So you just really need a plan. But what's going to happen is December 31st this year, you're going to know what that amount is. You're going to have a bucket of deferred taxes, and that's money that you've kept, and you're going to know exactly how much it is. And so maybe starting January 21, you just start saving $5,000 a month, $5,000 a week, whatever it is, so that come December, you can just write a check for the first half, and then December of 2022, the second half. So that's how that works. As for what I already said, what the tax form looked like. So let's say that maybe you did already file your second quarter and you really could use that extra money. It does appear that you can file, or even if you have not filed yet, but you already paid in the taxes, it looks like you can put on there on your 941, let's say just today's the first you're hearing of it and you're like, I haven't done my 941 yet. Okay, and you want that money, here's what you do. On that line, you put in your employer Social Security, the total amount of your employee's Social Security tax. And let's say it's $65,000 for the second quarter. That's your deferral. You've already paid it in. So when you work through the 941, you're going to have a $65,000 credit. There is a form, and forgive me for looking at my phone, but there is a form that you can request. Form 7200 is a form to claim an advance refund on the amount you already paid in that you now want to defer and you want that money back. Okay, 7200, form 7200. I haven't even looked at it. I had a team member researching this as I was honestly scarfing down a sandwich and getting ready. So if you've already filed your tax return, if it's worth it, I think I might amend my tax return, because all the payroll tax return, all you've got to do is file an amendment, show that amount, let's say it's at 65,000 on that line item. It's going to show a refund, and then file that 7200 form to claim that refund. It's an advance refund, meaning it's supposed to get here quickly. I know there are lots of individuals that have refunds out there, like regular income tax refunds. It's taken forever to get them, just forever. Now, Moving forward, again, you just heard about this today, you run payroll next week and you run your own payroll. And you're like, well, how do I defer my payroll taxes? Again, I don't know how QuickBooks has it set up. I know, and I don't know, I bet every payroll company is doing it a little bit different. I did hear, this was early on, that ADP was going to draft the full amount and then refund simultaneously, and I kind of get it because I understand their system, simultaneously refund the Social Security tax to you. You hold the tax, but you got to keep track of it and everything. So since they've got to file that on the 941 form, they're going to have to track it some way. So if you're with a payroll company, I think they're going to take care of it for you. You just want to make sure that they're tracking, you know, there's a bucket somewhere tracking that, like, you know what that number is. If you're doing payroll yourself, QuickBooks, I don't know what that looks like. It's going to be, there's going to be an item because it's got to be populated onto the 941. And so those are the questions you want to ask. Where do I put this? Where does it go? But again, basically, if your normal tax deposit is, you know, $30,000 and 5,000 of it is Social Security, which is not to scale at all, you're just going to pay in 25 and you're going to keep the 5,000. So just be really, really smart with that money. Don't put yourself in a financial hole or problem and not be ready to pay that money back. Let's launch a polling question. I only did one, and I just launched it. I like to always read it to you. Of the financial topics that we've covered in the series, and those maybe not covered but are relevant, what would you like to hear more of, either from me or any of our group? And you can choose multiple. And so PPP, HHS, building a stronger financial picture, which is what I had intended on presenting on. Streamlining your back office, I can speak for hours on that. I'm very passionate about that. Payroll tax credits, more on the paid sick leave, and are you tired of hearing me talk yet? And nobody's voted for that one yet, so I appreciate that. All right, let me give that a few more seconds. All right, let me close it out and I'll share these results with you. They're pretty evenly dispersed. Coming in first is the good old PPP forgiveness. We will definitely be having some more sessions on that. I know I speak for TAC a couple of times next month. Well, in the annual meeting, I speak at the very beginning on a panel with Elia Care, and then I speak at the end. They're kind of backwards. I feel like my presentation at the end really needs to come first, but it's going to be an update on all of these financial impacts. So anyways, and then building a stronger financial picture is something that I definitely will be probably putting together something on, because I do have, I don't want to say a lot, but I don't think we're finished feeling the brunt of it here in Texas, but I do feel like there are going to be a lot of people that have more cash on hand, or were able to pivot quickly enough, effectively enough to really take advantage of some of these benefits, that they're going to have more money on hand, or vice versa. You had some people that were maybe really heavy on like administration or not very efficient with their cost, that had to pivot and had no choice. And now they're like, we're getting good at this, or this was really hard for us. How can we do this better next time? That's some of the kind of conversations I want to get into. And I will say, go get a good banking relationship. I am right in the middle of transitioning to my small bank away from Chase, and it's a big task, but I'm going to do it. So okay, I've finished sharing the polling results. Okay, guys, I'm going to jump into these questions and answers, and we've got several of them. It looks like we've got some that have been answered so far. Again, the recording and the slides will be posted on the website. You will get a follow-up email tomorrow afternoon from Zoom. It's automatic. That will have a link to that website, just redirecting you back there, but it's the same place that you register. I think we get the video recording up by like tomorrow morning-ish. Or so don't be overly zealous to get it done. I do always post all of this. We host them on our YouTube channel. So anyways, questions. So if my employee is out due to exposure, do I have to pay for 14-day quarantine? No. First of all, it is 10 days, not 14 days. 14 days, because really they're looking at a work week, even if you're a 7 day a week, 7 days a week thing, it's 10 days. So be sure you're clear on that. You do not have to, as a healthcare provider, you are exempt from this. However, I believe Richard is going to say, and I feel the same way, if you do it for one, you have to do it for all. If you do it for your office staff, you have to do it for all your field staff. I would be consistent on how you apply the policy. And so if you're not going to apply it, then don't apply it to anybody. You can't play favorites. So if they're out on exposure, due to exposure, you do not have to. However, you can, if you wish, to do it and claim that credit. Okay? If our agency is over 500 employees, we don't have to worry about employee can choose to take regular FMLA sick time, correct? I know that you're not over, if your company has over 500 employees, you're not subject to the Families First Coronavirus Response Act, which is the expanded medical leave and emergency paid sick leave. I don't know what you are responsible for in place of it, and I apologize. So I don't know if it's just the regular family medical leave or if there's something more, but I would be looking, is there something else that addressed large employers? If an agency has PPP loan, can we claim tax credits? Yes, ma'am. And I hope you're feeling better. I recognize the name. Yes, so if you have a PPP loan, you can claim these tax credits. Not to be confused with, there's also an employer retention tax credit. If you had a PPP loan, you cannot also get those. Employee retention tax credit, not the same, that's different. And I'm sorry there's so much. I mean, I guess it's a good thing, but there's a lot and it does get very confusing. For liability purposes and protection of clients, sounds legal, I have put caregivers in quarantine with paid sick leave because they have been exposed to COVID positive persons. I immediately had them tested, test results later came back negative. Would these caregiver payrolls be eligible? I believe yes, Jeff. I think that just the fact that they were exposed and potential but then tested negative, there's nothing that says they had to be positive, and there's nothing that says if tests come back negative that they're disqualified. So what I would do is I would document all of that I would document they were exposed to positive people, that you made them quarantine and made them get tested, and here are their test results. Now, once their test result was negative, they resume work. So depending on how long that took, you know, if they, you know, day 1 of quarantine and then day 3 or 4, they got their test results, I think those 3 or 4 days of pay qualify, but not 2 full weeks, okay? Hope that answered that question. I have several personal attendants that were quarantined, all came out negative, never had symptoms. My question on this would be, why did they quarantine? If they self-quarantine, that does not qualify. That's the big differentiating factor here. And again, this is where you might need to have that thought process of, if I'm offering this pay and people are taking advantage of me and they're just self-quarantining because they don't want to work, that doesn't qualify, and maybe you do not want to offer this, and you can claim, hey, we're a healthcare provider, we're exempt from this. Another reason why you would claim we're a healthcare provider and we're exempt is if it is detrimental to your work staff and you can't provide the client services that you need to provide, right? That's another reason why you can exempt out of it. So for that, if they just self-quarantine, now if it was like the last gentleman where they were exposed to somebody, or even let's say they were exposed to somebody that showed symptoms that was then negative, but they were exposed to that person, you had them quarantine and get test results, and it still was negative, I think that's all okay. I hope Richard agrees with me on all this. I will say we have not talked about it, but I hope my interpretation is the same. I'm very aggressive. You know, lawyers are very conservative. I would never make a good lawyer. I'm also very black and white. You know, that's why I like numbers. If my company falls under as provider not required to pay these, can we choose to pay them to full-time employees but not PRN? This is going to be a Richard question. I don't think so. And I cannot say that. I don't say that because I've read it somewhere. I just don't think you can pick and choose who you apply it to. I could be wrong, but we definitely want to highlight this one for Richard. So I don't know how to flag that, but I will. We don't provide sick leave to our providers. Do we have to pay them for 2 weeks if they quarantine? You do not have to. Again, same thing. You do not have to provide any of this pay as a healthcare provider. And again, I go back to, it depends on why they quarantined. If they just quarantined for 2 weeks because that's trendy, no, that does not. They've got to qualify for one of those reasons. They had to be told to quarantine. They had to have shown symptoms and gone to seek treatment. They had to have been told by a healthcare provider to quarantine. They have to be caring for somebody else because of it. So there's got to be a reason why they quarantined. I did not pay them at the time they were exposed at a family party. Can I pay them now? The question on that is, if they were exposed at a family party and then they quarantined while they were getting tested, I guess I need to be a little bit more careful here, because if they're just quarantined because they were exposed, I don't feel like that meets one of those items, qualifying reasons, because if they're not showing any symptoms, they're missing that one. So they had to have been told to quarantine by either the government or a healthcare provider. Now, so Charity, you got any insight on this, or Heidi?
You know, we had a similar situation come up. I think in that case, they really need to speak with an attorney from the perspective of what are their potential liabilities. That's one that there's not a lot of clear definition around, and we actually have had that question, and that's exactly what we did, was refer them to speak to their attorney from the perspective of, because there's no real way to define, you know, where that person was exposed as far as if they get a positive test, did they get it at the grocery store, you know, that sort of thing.
Okay, yeah. So that's going to be a we do not know. Again, we're going to provide these questions all over to Richard so he kind of sees what questions are coming up. Oops, cancel. I hit the wrong button. I have several personal attendants that were quarantined that all came out negative, never had symptoms. I did not pay them at the time they were exposed. Oh, this is kind of the same question. Can I pay them now? Again, I'm going to defer to HR or an attorney on that one, just because there's not, I mean, if they think they were exposed, we're going to defer that to attorney. So let's leave that for Richard for next week.
Yeah, and Amy, I'll add to that real quick. I think especially in the case that someone just brought up, you know, that's one of those where, so they were negative, you know, their exposure was not work related. I think that really could be one of those judgment calls as far as how comfortable are you, for example, claiming this as something that qualifies. And again, that's an advisor type question.
Yeah, and so like coming to me as an advisor, what I'm going to look at is, okay, how are we going to justify this when the IRS asks for proof? And their, proof is, who were they quarantined by? That's where I feel like that's lacking. Who quarantined them? The
Right.
employer
Well, and what are
required her.
right. Yeah, and I'm sorry, Amy, I didn't mean to talk over you.
That's okay.
Yeah, I think it's who quarantined them and even what were the other potential exposures. Anyone going to the grocery store right now or getting gas or doing normal activities can be exposed. But when you have situations where people went to group gatherings or, I still laugh right now. We had a question 3 months ago when this first started about the employee who was fine when they left work, then went to Dollywood on vacation and came back and tested positive. I mean, that was actually one of our very first calls that we got from a client agency. And, you can't necessarily say that the person got it at Dollywood versus maybe getting it at work before they left. But at the same time, that gets down to there's no black and white answer to that. It really does depend on every individual circumstance and what the potential risk level is. For one, do you pay them or not as an employer decision? But also along with that, if you're able to take some of these advantages of some of these financial programs, what are you comfortable saying you would stand behind in the chance of an audit type situation?
Right, exactly.
And I would say that, if you're, you have to have someone that's actually ordering that quarantine, because otherwise think about how open that really is.
Right.
That's just, yeah. So it has to be, it's like doing self-monitoring. If you're exposed, you're going to monitor yourself. So
yeah.
That's what you should be doing.
And so I think you could go back and well, I don't even know if you didn't pay them at all, maybe you could go back and pay them if they did have a doctor's quarantine order and, maybe they presented with the doctor with symptoms. The doctor said, look, you need a quarantine. Let's do some testing. And they were out for 5 days waiting on testing, still came back negative, but they had a doctor's order because I had that happen. I still paid it and I feel confident standing before the IRS to say, no, she had a doctor's order and she got tested, which it says nothing about getting tested, but that's why she was only out for 5 days because she got the test results on the 5th day and came back on day 6 because she was negative. She had a sinus infection or, whatever it was. So that's kind of from my perspective, I'm looking at the tax credit side more than the liability side. So
right, and Amy, we can flag that. We can flag
yeah.
that for Richard. I do think one of the key points here, and you hit on it, is the documentation around it. Is to make sure that if there are doctor's notes, if there are orders, anything specific like that from a documentation standpoint. As a nurse, I'll quote what we're all told in the first semester of nursing school: if you didn't write it, you didn't do it. That's not necessarily going to be a black and white in this scenario because some of these won't have specific documentation. However, any documentation that you can get to put into the employee's file will help. So if they do mention that they self-quarantine, what prompted it? Is there any documentation of them even doing outreach to their doctor? Anything like that, I think, would probably help. Richard can answer that more specifically, but I do think that that would help if there is anything like that.
That's so funny. And then, us CPAs, we have what we call CYA, cover your ass. And so, we do a lot of things to cover ourselves in writing, but then there are some times where so I'm heavy email and where we might just pick up the phone and say, look, I need to talk to you, but I don't really want it in writing. So we can say it never happened. So yeah, document. So this question's a little bit off of that topic, but still very valid. Can we still pay regular payroll from HHS funds once the PPP loan is finished? No, you cannot. Well, let me rephrase that. HHS funds, they really need to be in a separate bank account. People have fought me on this, but there's a real specific reason we're saying it. They need to be in a separate bank account at the bank and they need to stay there, even if it's just a savings account. there's two ways you can justify spending that money. One is additional incurred expenses because of COVID. Extra PPE, help with your emergency preparedness plan, extra fees to your accountant for dealing with all this, just very specific sanitation, workforce implementation, work from home, you know, kind of things. Those are additional expenses paid directly because of COVID. That's reason number one. Reason number two is lost revenue. When you justify that withdraw from that account for lost revenue purposes, you document, you say, you know, the month of June, I dropped 10 patients. I get an average of $2,500 a patient. I'm down $25,000 for the month of June. I'm withdrawing $25,000 from HHS funds to cover those lost revenues. Now, you've justified the withdrawal from the fund, but you still have to spend it on operating expenses. It's still got to be spent on allowable expenses. It can't just be spent on a $25,000 owner's distribution. But if you've justified it with lost revenue, you can spend it on regular operating payroll. Now, on the first way you can justify that additional expense, if you're paying hazard pay, COVID bonuses, COVID missed pays, anything that's COVID related, like extra because of COVID. I have a nursing home that had, I have two, that had COVID breakouts. One confined it to one patient and one had like 20 patients, took a really bad hit. They have to physically staff extra people. So they have whole extra shifts, not a shift, but extra positions on the floor. That payroll, those wages are extra COVID wages. That can come out of justification number one, additional expenses. But then when you justify lost revenue, you can use that for regular payroll, contract payments, you know, contract labor, mileage, rent, anything. Anything to continue operations, not distributions, probably not marketing. Okay, I hope that answered that question. I know it gets very confusing. Is there a form to be filled out by employee for sick leave credit? What type of documentation do I need to substantiate the credit? Great question. There is not a form, although I highly recommend creating one. Like just, you know what, that'd be a great question to go into the TAC forum if you're a TAC member. But I would encourage creating some kind of form. I do not have it handy, but I did do a form for myself that documented employee's name. I don't think I might have done employee hire date, I'm not sure. Date of leave request, the date they requested leave, the start date, the end date of leave, the reason they requested leave. I put all of this in a Word document and I made the employee sign it. And then I did ask for, I asked for a doctor's note. So they sent me their testing, like where they, confirmation that they scheduled for testing, their testing results. And these were screenshots off of a phone app. I documented it. I'd save that image into a document. This is not defined anywhere. So it's just going to be what's best. Charity's got some comments. Did you have something, Charity? Oh, I thought she was going to add to it. Oh, okay. I thought she was raising her hand like, I got the idea. So I think more is better than less on that. But you definitely, it needs something that shows why they were quarantined and like who issued that quarantine. No matter if an employee is positive or negative for COVID, as long as the employer receives documentation from the employee showing they were ordered to quarantine, you can pay them with the sick pay. Yes, that is true. So nothing says it had to turn out negative, but if somebody ordered them to be quarantined and you've got that order, then you're covered and you can claim the credit. On HHS money, can we request to get less than $750,000, or do we have no control over what they give you? That's a great question. They basically tried to distribute 2% of net revenue. And so that you didn't have any control on what they gave you. I do think you can pay part of it back. I would go to the HHS Provider Relief Fund portal, a website, and there is a ton of information there. I don't know the exact answer to that question because I literally just saw this news this morning. So I haven't even had time other than to read the post from Mueller Post posted it. For sick leave, is the total 80 hours for 10 weeks or just 80 hours in a 10-week? No, it's sick leave is 80 hours for 2 weeks, 2 weeks only. So 40 hours a week, this is full time. The 10 weeks is if they are caring for a child and there's no child care available. After the 2 weeks of sick leave, they can get 10 additional weeks of family leave. That's where the 10 weeks comes from. Is COVID-19 pay a requirement based on policy by agency? This would refer to attendants that work with COVID. No, it's not based on anything like that. Again, you can, I mean, if you want to be super prim and proper, which I think is a great idea, you can adopt a policy for your agency that states we will pay this and these are the requirements, or we will not be paying this because we are a healthcare provider. That would be a policy that I think you should adopt and put in writing. And maybe you don't disseminate it to anybody because you don't want everybody just trying to create reasons to stay home and get paid. But I would be clear, and remember, you need to know who quarantined them and have that documentation that they were quarantined. Self-quarantine does not qualify. On sick leave, will we be able to claim all paid COVID sick leave even if we paid more than 2 weeks? Because say we had employees who were exposed or tested positive and paid sick leave while testing, then was exposed or tested positive again weeks later and was paid again later, can we claim? No. So that has been very clearly addressed. The question is basically they qualified, in June, we paid out 2 weeks, everything's good, but then in September it happens again for the same employee. No, each employee has a max of 10 days. 10 days, 2 weeks, 80 hours max. And now it could be 3 days here and 7 days later, but once that 10 days or 80 hours is used up, they have to just go into their regular PTO or sick pay bucket, and you don't get any credit for that. Are essential caregivers exempt from sick leave, or is it a requirement for all types of employers? It just says healthcare providers. So all healthcare providers can be exempt from this sick leave requirement. Again, you can offer it if you want to. We have a lot of questions. Employee went out on 6/24 with COVID symptoms, got tested 6/26. On 6/28, reported that the lab told the test was inconclusive, stayed home, got retested, reported negative, now stated that her 2-year-old son has tested on 6/30, and that was never reported to the agency, positive, and finally returned to work on 7/20. And found out that the original test of, I think some words went missing here. We are a large employer. How do we handle this? What is our damage? As a large employer, I don't know what your responsibilities are. I apologize. I just don't work with anybody over that category. I highly recommend you visit with your HR department and what policies, and legislation applies to you. So, and Richard may know some of these. So again, he'll see these questions and maybe he'll have more for the large employers. Original test report found to be negative upon work. It doesn't matter if the test was negative if there was an actual order to be quarantined, or they showed symptoms and were seeking a diagnosis. Back to my question, and I'm sorry, I don't remember which one was your question. It says on COVID-19 pay, I was referring to attendants that are working with COVID-19 positive clients. So I'm not sure what the question is. I apologize.
Amy, this is Charity.
Uh-huh.
I just pulled up the answered questions, and this this attendee asked, you may have already addressed this. Is COVID-19 pay a requirement, or is it based on policy by agency? And this would refer to attendants that work with COVID-19 attendants. And then the subsequent part of that was they were referring to attendants that work with COVID-19 patients, not other attendants.
Okay. I don't think it matters whether they're working with COVID-19 patients or not. I think you'll get into discrimination if you offer it to some and not others. It's kind of my stance on that. Can we choose to just decline HHS funds? Yes, you can. There is a explanation in there on how to return the funds. So what will happen, if you haven't gotten any yet, then you don't have to worry about it. Just don't apply for what's out there right now is the Medicaid distribution, and you have to physically go apply for it. If you don't want any, just don't apply. If you already received some, if you went past that 30-day, 60-day, I think it was 60-day terms and conditions, and you didn't return it then you've already accepted it by default. If you sign the terms and conditions, you've accepted it. If that time period has not lapsed, there is a process by which you can return the funds. And I don't know, but I would not be surprised if when reporting comes out, they also give the option to just return it. Kind of like they did with PPP loans. In the beginning, everybody got one, and then people say, you know what, this is for the little guys, I'm gonna return mine. No harm, no foul, and they did that. Will sick leave paid to employee be reported on their W-2? Yes, that is a great question. It will be reported on their W-2, same as if you were paying them sick leave from their PTO bucket or your PTO, your sick leave policy. So this is not the same as when an employee third-party sick leave. Like, this isn't the same as a third-party sick pay. That is kind of like an insurance benefit. Which gets reported differently. Sometimes it's on their W-2, sometimes it's not. I know this much about that, but this will be on their W-2. Are the credits to be counted as income for the company? Thank you for asking that question. I forgot to address it. Not exactly, but pretty much. The credits should be used, depending on how you do your accounting. We are going to put the credits as a offset to the wages paid. We probably won't really do that. We'll probably put the credit as other income. But yes, it will serve as taxable income for, basically you can't deduct those expenses. I'll have to see how it gets reported on the 941 versus 940 versus W3 to figure out how we put it in our general ledgers, because we always tie down our trial balance to make it match the 940. So I'm not exactly sure what that'll look like. Yes, but yes, it's going to be taxable. Are HHS funds to be considered taxable income? Yes. That is there to be replacement of lost income or to cover additional expenses. It is absolutely revenue. We are actually even recording it as it's justified. That's the word I keep using. As you justify pulling from that fund, we are calling that earned revenue. For instance, I met with somebody yesterday who there is a manager that her bonus structure is based on gross profit. Well, visits are way down, census is down, that's going to hurt them. And payroll is still up, so getting kind of double whammy, but the HHS funds are going to replace that income. So for bonus structure purposes, we're calling that regular income because you've kind of maintained, you know, in their case, they're just now going to start phasing out some of the payroll to bring the payroll down in line with the census because the PPP funds just ran out. So yes, it is income. It's the long answer. It's the short answer of my long answer. That was the last question. Let me see what's on chat. Again, we will have the slides. Are you allowed to ask for forgiveness of HHS if you use HHS to pay for what the PPP is not covering on the payroll for the, no, you cannot mix HHS and PPP, and you cannot use HHS money to cover payroll just because you ran out of PPP unless you've justified it with lost revenue, and it's got to be super clean, your accounting records. Could you list home health related HHS expenses, please? Yes, I'll try. And I would also recommend you look at, Charity was at the last week's webinar that I went in. I don't think I went into detail. It was probably week 1 that I did the most detail on that. So week 1, I probably had some slides. So HHS additional expenses would be like, PPE is the obvious one, hand sanitizer, disinfectants, but also things like beefing up your emergency preparedness plan, software expenses to allow you to work from home and let your team work from home, telehealth expenses that you were not already incurring. Like if you're already doing telehealth, you don't get to count it. But if you've implemented telehealth, if you've implemented, you know, maybe to save on-call dollars, you implemented an on-call service instead of paying staff to maybe lessen the exposure. I am going fairly conservative because they are going to look at everything. I think you really want to make sure it's very clear that this was a COVID expense. We've also talked about and seen examples of like software, even hardware cost. One agency, you know, sent the staff home, the office staff home, and they took laptops. And he's like, you know, I'd rather have laptops back in the office and I could buy everybody, I'm sorry, I said it backwards, desktops. They took desktops home. Let's put the desktops back in the office. Let's buy laptops to go home. So that's a COVID expense. Now, is paying off your car a COVID expense? No, it's not. Please don't email me and ask me that question. Is paying your mortgage a COVID expense? It is not. However, it is an allowable expense if you've justified it through lost revenue. You can pay off, not pay off your mortgage, but make your regular minimum mortgage payment. So that's kind of how those start breaking down. Now, again, once you've justified it with lost revenue, which some people can do that 100%. If they just say, you know what, I'm just going to say lost revenue. I've dropped so much in business that this really doesn't even cover my lost revenue. I'm going to justify it all with lost revenue. Then you can use those funds for any of your normal operating expenses. Payroll, contract labor, mileage, rent, utilities, software. I would probably steer clear of marketing. You know, use your regular operating funds for marketing just because it's not allowable under Medicare or Medicaid, like cost reporting rules. So that's kind of what I got on that. And that looks like that's all the chat and no more new questions. So I'll go ahead and wrap this up, guys. We'll get it recorded and online for you, and you'll get an email. I encourage you, when you go look at the video, you'll be on my YouTube channel. Feel free to subscribe, because if you subscribe, you'll get a notification when I post updates. And that's the easiest way for me to get messages out, is via a message update. So let me see, I think we got some more slides on how to contact us, sorry. And I'll let Charity close this out.
Okay, Amy, can you, there you go. So Amy's contact information is listed on the one slide. And then we do want to say thank you to everyone for attending. Next week's session is going to be the legal aspects of pandemic recovery, which we were not able to cover today, unfortunately. But thank you again to Amy for jumping in and doing what you did to make sure we have really great content for today. If you do have any challenges with registering for any of the sessions, the information on who to contact is listed here. And as Amy said, you will be redirected in the reminder email from Zoom or it will redirect you to the webinar series website, but the link is here also. If you want to type that into your browser, you can get to it that way. And it has all of the registration links, the recordings, and the slides. And so thanks to everyone for joining today. And we appreciate it. Now, Amy, someone just popped in and asked, what is the YouTube channel? So what's the easiest way for them to get directly to it?
Oh, good question. So if you just go to YouTube and just search Knight CPA Group, Knight with a K, Knight CPA Group, you should find it. Should be there. I don't have a lot, although I'm starting to get some subscribers. I think I had like 73 last time I looked, but there's, and be careful about watching old PPS, PPP, and HHS videos. You always want to go with the more recent ones because so much has changed since the first couple that we put out, because we kind of jumped on this pretty early. So we're trying to do them anytime there's updates. And I honestly plan on, just part of my practice, because I enjoy doing these webinars, it's just, I just plan on doing, not weekly, it's a lot, but monthly, just a monthly webinar, just on whatever the hot topic is, bringing guest speakers. You know, I'll be calling up Heidi and Charity, say what's hot, what's going on lately, you know. So so yeah, I highly encourage you to subscribe there. I don't generally put any rants or any crap out there. At least I don't think so. So all right, everybody, I'm gonna hit stop recording, I think, and we will see you next week. Thanks, everybody.